You would not believe how many questions I get about this device right here. This is Morpheus8, and there's a lot of misinformation about this device online. And so in this video, I'm here to dispel all the myths and give you information to help you decide if this treatment is the best for you. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I've used Morpheus8 since its launch somewhere around 2018. I've had it in my office, using it consistently almost every day, getting really beautiful results, but it took me a long time to really understand the best settings and the right skin prep and aftercare. So this device, just like anything, is a tool, and used by the right hands, it gives great results. But if the wrong person is using it, it can lead to some problems. So what is Morpheus8? So Morpheus8 is radio frequency microneedling, and it uses bipolar radio frequency, meaning you don't have to use grounding pads or anything like that. We're delivering heat deep into the skin using tiny pins. There are a couple different tips with Morpheus8. Here's one. This is our resurfacing tip. This is the one I use in some patients who have lighter skin type. I don't use this tip in darker skin type. It can lead to something called post-inflammatory hyperpigmentation. So I only use this tip in lighter skin types. This is the most common tip. This is a 24-pin tip. You can see if I push the plunger, like what the machine does, you can see those tiny pins here. This is a coated tip, so it's only delivering energy right in the tips of the pins. So the reason why it's safe for all skin types is that we're bypassing the epidermis, delivering heat deep into the dermis. So this is very different. Another similar tip is this one. This is for the body. This is a 48-pin tip, and it can go as deep as 8 millimeters, delivering energy deep into the skin and subcutaneous fat. The only tip that I don't have here is the prime tip. It's 12 pins. It's just small to fit kind of right underneath the eyes or in tiny crevices. I don't use that one quite as much, but it's similar to the 24 and the 48-pin tip, where it's coated, where we're just delivering energy bypassing the epidermis. So that's why it's safe for all skin types if you're not using the resurfacing tip. And so it's really important for the provider giving you the treatment to know the difference between the tips and the depth. With the 24-pin tip, I can go as deep as 4 millimeters, but I'm not really going 3 and 4 millimeters unless I want to reduce fat or volume. And so that's one thing that a lot of people are nervous about with Morpheus8, and there's a lot of information online with horror stories. When people get fat loss, it means that the person doing their treatment went too deep. And when they're doing that, they have good intentions, but they were trained improperly. So if you're going too deep in someone with really thin skin, what they're trying to do is tighten the SMAS, the supramuscular aponeurotic system. The SMAS sits, if I go through the different layers of the skin, you have your epidermis, the dermis, the fat layer, and then the SMAS. The SMAS is what we lift in a facelift. So in a deep plane facelift, when I'm going in, I'm elevating deep to the SMAS and then lifting the SMAS up in a more superior position. And so you can't really have a facelift like results without having a facelift, unfortunately. But a lot of people are trying to deliver those type of results. So if for instance, if someone is going 4 millimeters in the upper face here, trying to get deep to the SMAS, you're gonna bypass that fat layer and melt it, because that heat will melt the fat layer. So definitely with Morpheus8, you can melt fat and thin out some of the skin, which we don't want in the upper face, especially up here. There are certain instances where someone may have some fullness underneath their chin or even a jowl, where I can actually contour along their jawline with the Morpheus8 going a little bit deeper. But it's pretty rare that I go deeper than 2 millimeters if I'm treating someone with thinner skin and not a lot of fat in their face. I actually have my facelift patients do a series of Morpheus8 before a facelift, because what I find is, after we lose 1 to 2% of collagen and elastin every year, starting in your 20s, by the time you get to the point of needing a facelift, your skin is very thin and elastic. And sometimes as I am manipulating the skin in surgery, we're holding it with tiny forceps and skin hooks, and it can be so thin that it's very hard to hold. And when that happens, also after surgery, you can have some like rebound relaxation and a little bit of skin laxity after surgery. So if I pre-treat the skin, even with one treatment, a Morpheus, but certainly after 3, I notice that the dermis is a lot thicker and stronger, and I'm able to reposition the tissues in a much better way where you don't get that rebound laxity afterwards. So, some people are saying that Morpheus8 shouldn't be done before facelift, but if used with the right settings and the right depths, I have not seen a problem with it at all. But if you're going too deep, certainly that can be an issue. Uh, One other thing that some people are worried about is scarring. And like, I'll show you these tips again. These tips are delivering energy, and I have the control of how much energy I'm delivering in each tip. You can stack pulses, meaning pulsing it twice while the pins are deep into the skin, and you can really crank the energy up if you wanted to. Now, I have noticed that it doesn't take a lot of energy to get a good result with Morpheus8. And you can use higher energy settings the deeper you go. So if I'm more superficial at 1 and 2 millimeters, I'm keeping the energy fairly low because it can damage and overheat the skin, leading to less structure, and it's kind of preventing what you're trying to fix at that point. And so less is more when it comes to Morpheus8, but some people are not following that algorithm. And I've seen some damaged skin from that. I used to try to use some higher settings earlier on when I was using it. Certainly, I've had results that could have been better early on. And that's how I've learned over the course of 7 years now using the device that it really follows a specific algorithm of your maximum settings that you want to use at each depth. Um, Other things that you can see with Morpheus8 are striping and redness that can be prolonged. So with the plates here, so the plates on either side, the energy will go in one side, or actually come out one side and then go back in the other plate. That's why it's bipolar radio frequency. Um, if you don't have good contact with the skin, or if you have surface oils that interact with these plates, it can cause something called striping. It's like a little red stripes that are tiny little burns, actually, that they will eventually heal, but it can cause some prolonged healing time. Everyone I see for Morpheus8, we prep the skin very specifically. So we'll double cleanse the skin, make sure all of the numbing cream is off, and then prep the skin with alcohol, and that removes any surface oils. The other thing you want to do is get really good contact with the skin. You want to actually be able to see the cross hatches of the tip when you're moving from place to place, because if you don't do that, you're not getting good enough contact to prevent arcing of the energy from the plates to the skin. I haven't had a problem since using this algorithm for pre-treatment and the actual treatment technique. And so not something I have to worry about anymore. Now, aftercare is also really important, both at the time of your treatment as well as once you go home. So all of my patients having Morpheus8 will get topical exosomes, meaning I use a company called Benev. So it has a serum with hyaluronic acid, antioxidants, and then the exosome, which are little nanoparticles that deliver messages to your skin to turn on your body's own stem cells. I place that on immediately afterwards, and it can really use those microchannels to go deeper into the skin. And then the hyaluronic acid and antioxidants decrease inflammation and redness right away. And then you get the long-term benefit of the exosomes to build more collagen over time. Immediately after the exosomes dry on the skin, I'll apply Elastin Skin Nectar. Really love the Elastin product line for aftercare, after lasers or Morpheus8. And after that, at the time of the treatment, I'll put on a laser balm to prevent any little micro scabs that look like tiny little red dots. I don't have anyone continue the balm at home. What you do at home, just using a gentle cleanser, the skin nectar, and some sunscreen, it's all you need for about a week, where the skin feels a little like snake skin. It's not peeling like a laser treatment, but it just feels really dry. So the downtime with Morpheus8 is pretty low as long as you're doing the aftercare correctly. I do see a little bit more downtime with the resurfacing tip because these tips are not coated. So this is an ablative tip. So you're delivering energy along the entire length of the pins. And so we can't use it for darker skin types, but it will cause a little bit more redness. But in areas where you have more superficial fine lines, it works like a charm. So um, I don't ever worry about scarring or redness at this point if you're using the right technique. The last thing that most people are really worried about with Morpheus8 is pain. And I've gone through several iterations of pain management after Morpheus8 and during the treatment. Right now, I use a topical plasticized gel that I have only certain compounding pharmacies will make. And I'll prescribe that ahead of time for the patients. They'll put it on an hour and a half before coming in. And so they're coming in pretty numb. And I offer nerve blocks if anyone needs them, but for the most part, I haven't had to do nerve blocks in anyone in a very long time. The plasticized gel really makes a huge difference. We do have nitrous gas, nitrous oxide, if anyone needs it, and of course nerve blocks, but it's just not a real big issue. You can have some of that topical numbing wear off if the treatment is going on too long. So if someone's doing your treatment and they're going a little slow because they haven't done as many treatments as others, then by the time you get to the neck or whatever area they're doing last, it can be partially worn off at that point. So I like to go fast but still remain with good contact on the skin. And usually the treatment's pretty easy. I hope this really helps you. I don't want anyone to be scared of Morpheus8. I do this treatment all the time in my office. I can't tell you how many treatments done myself. I love it. You get a natural glow to your skin, and it complements surgery really nicely if done appropriately. So if you have any questions about Morpheus8, please leave a comment below. Happy to answer any questions you have.